Nursing 345, General Survey, Measurements, and Vital Signs. Here are the objectives for this week. Describe the 8 characteristics included in the summary of each patient's symptom. Relate developmental care during health history for a child or older adult. Discuss the use of inspection, palpation, percussion, and auscultation as a physical exam technique. Understand the use of blood pressure cuff of improper size to the possible findings that may be obtained. List the information considered in each of the 4 areas of general survey, which are physical appearance, body structure, mobility, and behavior. Assess and acknowledge the different types of pain. Recognize developmental care as well as cross-cultural and gender considerations regarding pain. List the steps of a complete health assessment. Explain the difference between a focus and a complete health assessment. Describe the techniques needed to perform a complete history and physical exam. Document the results of the exam and identify the tools needed to complete a physical exam. The general survey is a study of the whole person, covering the general health state and any obvious physical characteristics. It covers 4 areas, which include physical appearance, body structure, mobility, and behavior. Changes in any area may indicate illness. Physical appearance includes an assessment of the person's age, sex, level of consciousness, skin color, facial features, and overall appearance. Body structure addresses stature, nutrition, symmetry, posture, position, body build or contour, and any obvious deformities. Mobility is concerned with gait, range of motion, and the presence of involuntary movement. Behavior considers facial expression, mood and affect, speech, dress, and personal hygiene. There are several developmental considerations to apply to the general survey. For a child, observe interactions with the accompanying adult. Unexpected behavior on the part of the adult or the child may be clues to child abuse, mental illness, or developmental disability or disorder. For an aging adult, be aware that posture, appearance, and mobility may change. By the 8th decade, spinal flexion may occur as well as an angulation of features and redistribution of body proportions. The gait may have a wider base to compensate for changes in balance. To measure weight, you may use a standardized balance or electronic standing scale. Instruct the person to remove heavy outer clothing and shoes before standing on the scale. To measure height, use a wall-mounted device or the measuring pole on the balance scale. Have the shoeless person stand straight and look straight ahead. These procedures do vary with infants, children, and patients who are unable to stand unassisted. Body mass index is a practical marker of optimal healthy weight for height and an indicator of obesity or malnutrition. Excess abdominal fat is an important independent risk factor for disease over and above that of the BMI, and that's why it is important that we obtain the waist circumference. Various routes of temperature measurement reflects the body's core temperature. The oral route is accurate and the most convenient. The rectal route is the most accurate route, and the result is as close to core temperature as possible without using more invasive measures. The tympanic route senses infrared emissions of the eardrum, so it is an accurate measurement of core temperature. The temporal artery thermometer uses infrared emissions from the temporal artery and provides an average of multiple readings. There are conflicting reports regarding the accuracy of the temporal artery thermometer. When palpating a peripheral pulse, assess 3 qualities: rate, rhythm, and force. In an adult at rest, the rate normally ranges from 50 to 95 beats per minute, but varies with age and gender. The pulse rhythm normally has an even, regular tempo. The force of the pulse shows the strength of the heart's stroke volume. To assess respirations, count them while your hand is still in position for taking the pulse. That way, the patient is unaware and that respirations are being counted and does not alter the breathing pattern. Normally, respirations are relaxed, regular, automatic, and silent. The normal rate varies with the patient's age, and the ratio of the pulse rate to the respiratory rate commonly is 4 to 1. For the blood pressure is the force of the blood pushing against blood vessels. Systolic pressure is the maximum pressure felt on the artery during left ventricular contraction, or systole. Diastolic pressure is the elastic recoil pressure the blood exerts constantly between contractions. Pulse pressure is the difference between systolic and diastolic pressures and reflects the stroke volume. Mean arterial pressure is the pressure forcing blood into the tissues, averaged over the cardiac cycle. In a young adult, several factors affect blood pressure, including age, gender, race, diurnal rhythm, weight, exercise, emotions, and stress. The blood pressure level is determined by 5 factors. The 5 factors are cardiac output, peripheral vascular resistance, volume of circulating blood, viscosity, and vessel wall elasticity. To obtain an accurate measurement, the width of the cuff's rubber bladder should equal 40% of the circumference of the person's arm. The length of the bladder should equal 80% of the circumference. A cuff that is too narrow yields a falsely high pressure because it takes extra pressure to compress the artery. A cuff that is too wide yields a falsely low pressure. With the patient's bare arm supported at heart level, center the cuff about 1 inch above the brachial artery and wrap it evenly. After placing the stethoscope belt over the brachial artery, inflate the cuff 20 to 30 millimeters above the point where the arterial pulsation is obliterate, then deflate it slowly, and note the points at which you hear Korsakoff sounds. The measurement of oxygen saturation. The measurement of oxygen saturation is an additional non-invasive method of general physical assessment. A sensor attached to the individual's finger or earlobe has a diode that emits light and measures light absorption of the blood flow.